much for coming and speaking with us today. Normally, we would be doing like street outreach right now. We have a homeless outreach ministry, but obviously, we're not doing that due to COVID. We just don't want to risk infecting anyone on the street. So we're just trying to focus on education, and we're really, really glad that you can be a part of that and speaking with us today. I've talked about you a lot, so I know most people here know. I took your class when I was a freshman. Catherine Parr, who might be joining us later, was also in that class. But I just wanted to give some background on some of the work that you've done. So you're currently a professor of social policy at the University of Pennsylvania School of Social Policy and Practice. And you're also the co-founder and co-director of the Actionable Intelligence for Social Policy Initiative and the former director of research for the National Center on Homelessness among Veterans at the United States Department of Veteran Affairs. So today, Professor Culhane is going to be talking about the impact of COVID on homelessness, and then he's going to take questions. But yeah, Professor Culhane, thank you so much for being here today.
Thank you, Courtney. And it is indeed a pleasure to be with all of you. I wish it could be in person, of course, but we have to make do with what we can in the midst of this crisis. In March, when we first started the lockdowns, and there was the CARES Act was under deliberation with the Congress. I was asked to, I had 36 hours to put together an estimate of what it would cost to provide quarantine and isolation capacity for a certain projected number of infections. And so we did that. I think we said it was around $11 billion to just reach the unsheltered, and including because of the density reduction. So I'll mention a little bit about that. But fortunately, the extent of infections in the homeless population has not been a worst case scenario. It's very much been an outbreak driven kind of event within specific facilities rather than community spread. And so there have been a number of outbreaks that have been pretty bad, reaching as high as 70% of the people in some facilities. But as I'll mention, there's been a whole other set of impacts, some positive, some concerning, that we've been able to see. So if I can, I'm gonna share this screen and get this to work, hopefully. And so you can see the screen well enough?
Yeah.
You see the full screen? Great. Okay. So I did this, I prepared this as a talk recently where there was people represented from different European countries, Canada, Australia, et cetera. We're all talking about this. Of course, a lot of researchers have been writing papers on this topic. So it was an opportunity to share some notes. It's just pretty interesting how similar things have evolved in these different countries. Even if, there's some unevenness in the response, even within the US. The crisis is happening in the context of some important things that relate to COVID. One is that we have a unique and accelerating aging process in the homeless population, which I'll mention in a moment. But it's basically reaching its peak over the next 3 to 5 years, but we're well underway with this problem. So it's sort of colliding with COVID in that regard. We have a very substantial growth in unsheltered homelessness on the West Coast, throughout California and in Oregon and Washington State, particularly in the Seattle area. And within the homeless population, we estimate that between 40 and 60% have comorbid conditions that make infection with COVID high risk for hospitalization, ICU use, and death. So it's a group that is significantly sicker than the general population, which poses unique risks to them. First, with regard to the aging, certainly I know Courtney probably recognizes this graph, but I've been showing this. This is basically showing you the age distribution of the adult homeless population comparing 1990, 2000, and 2010. And what you see here is in this light blue, back in 1990, where we had the first national count by the Census Bureau of the homeless population, you can see that the problem was dominated with people in their 20s to early 30s, early 20s to early 30s, excuse me, mid 20s to mid 30s. And basically, these are folks who were born between 1955 and 1965, which would be the second half of the baby boom. And you can see that in 2000, the curve has moved 10 years to the right, so that the average age was 40, being between 35 and 45. And then in 2010, it moves 10 years to the right again, with an average age, peak age of 50, being between 45 and 55. And now in 2020, when the census numbers come in, we will see that this curve has moved to the right yet again. And because we have data from multiple local jurisdictions, and basically they have an average age of 60 and are now between 55 and 65 years of age, the dominant group. It is not the same people who've been homeless for 30 years, but it is drawn from the same pool of people who are at very high risk for homelessness because of their long history of being in unstable housing, unstable in terms of their employment, having involvement with the criminal justice system. This is a group of people who came of age into young adulthood in the late 70s and early 80s when there were back-to-back recessions. As the second half of the baby boom, they were preceded by a large group of people who crowded out the housing market and crowded out the labor market. So when these folks arrived into young adulthood, if they didn't have good educational qualifications, so basically think high school education or less, there was really almost no room for them in the labor market. There was a big oversupply of workers, such that in 1983, as just one example, African-American men with a high school education in their 20s had an unemployment rate of 27%, which was double what it was 10 years earlier, double what it would be 10 years later. So this particular generation got squeezed quite intensively in terms of their economic opportunity. And there's a pretty substantial amount of research that shows that if you don't get into stable employment by your mid-20s, and you're a high school education or less person, the odds that you will ever have a sustaining long-term attachment to the labor market are really quite low. And the reason for that is that this is a critical transition period in age. And if you have no income and you don't get any public assistance as a single adult, you have to go into the underground labor market for any kind of income. And so back in this period, that underground market was dominated by crack cocaine. And it was a violent enterprise controlled by gangs that led to a lot of violence and killing, led to addiction, of course. And coinciding with this, the federal government's attitude was to get tough on crime, and on the war on drugs, focusing including on small-time users and dealers. And there was a 3 strikes you're out law that was passed so that the third arrest could send you away for a mandatory minimum sentence of 15 years. And so the whole mass incarceration movement was a response to the civil unrest that was associated with this violent drug market. And homelessness emerges in the midst of this. People's lives were derailed, quite significantly for decades as a result of this. And so at any given time, a small portion of the at-risk group is homeless, but 90% of them are in some kind of housing, but they move in and out over time as time progresses. So this is a significant fact. The main thing being that what's happening is the number of elderly homeless over 65 is growing significantly. And you can see this graph here we are in 2020. Boston is already on an average day close to triple where they were in 2011 in terms of the number of elderly homeless. And that is going to double yet again by 2030. So we're about a third of the way through the growth in elderly homeless. And if you work in homelessness, people who work in shelters, this is one of the things everyone's talking about, is that they cannot, that they're just overwhelmed with the number of aged people who have all sorts of aging related care needs that shelters are not designed for. Elderly homelessness has been very rare in the United States until recently. So this is a disruptive event that's happening, a slow flood. And I always say, if we're forecasting a flood that will reach our heads, we're already up to our knees in water at this time. So we're already in a growing crisis situation. Another big factor is the growing unsheltered homelessness on the West Coast. And this yellow trend line basically shows you the increase in unsheltered, non-chronic homeless people, which has gone up 71% since 2014 to 2019. 43,000 to 74,000 people, and much of this concentrated in California and Washington State. And it's causing a lot of trouble in those places. If you've ever visited California in the last couple of years, or if you've been to Seattle, it's unavoidable to see the misery and the scale of the misery quite beyond anything we would ever imagine here in Philadelphia. To be honest, it's about 70% of the homeless in California, for example, are unsheltered. They live on the street, whereas in Philadelphia, we're about 10% of our homeless population is unsheltered. So it's very different in terms of the scale and how it looks and feels on the street. And obviously, this is of concern because the living conditions on the street can be pretty unhealthful, and potential for people to catch and spread COVID would seem to be very likely. So as I mentioned in March, I was asked to project what the emergency housing needs were for people in the face of COVID who were homeless. And basically, here's the way we calculated it. We assumed that the density reduction in existing shelters to provide 100 square feet per person that would accommodate social distancing guidelines from the CDC was going to lead to cutting the number of existing beds in half. Most places, the congregate shelters are only 2 to 3 feet apart. So head to toe, they might only be a foot apart. So the idea of accommodating social distancing, we estimated that half the beds would be lost. And so that's 100,000 beds that would have to be made up for right there, just with the existing sheltered population. But the unsheltered population is estimated at 211,000 people. That's the people who were observed in 2018, not the people who were hidden. So other research suggests that we have a 40% undercount of unsheltered people. So if you add the unobserved to the observed, the number could be as much as 300,000 people who are unsheltered. So you take that 300,000 to shelter everyone, or if you just took the high risk people for COVID infection, that's still 180,000 beds. So you add the 100 to the 180, or add the 100 to the 300, and you've basically got a range here, 280,000 to accommodate bed loss, plus the high risk people, 400,000 for everybody who's unsheltered. And the top line cost for that would be 11.5 billion a year. At the end of the day, the Congress provided $4 billion in additional spending. And there's a pending request for the next CARES Act or its equivalent of the 7.5 billion. So we will see whether or not the Congress does that. It's likely that the next bill, which they're talking about passing this week even, would not include that full amount. So I've been working with the National Alliance to End Homelessness to do surveys of local homeless organizations. There's every community has a coordinating council for homeless services, if you will, called the Continuum of Care. And we reached out to them, and we've now done 3 rounds of surveys of them, one in April, one in July, and one just recently in October, to see how the homeless system is impacting these local organizations. And here's some of the results to share. Probably the biggest and most interesting accommodation has been 85% of the cities are using hotels and motels, which happen to be empty because of the decline in travel, for both people who test positive for COVID for their recuperation, and for people to prevent comorbid infection of people with high comorbidities. And this has been pretty substantial. In some places, like the state of Vermont, arguably not a big state, they actually took everyone out of the shelter system and put them in hotels and motels. There are 1,800 people in Vermont who are in hotels and motels. Connecticut got every single person who is unsheltered off the streets and put them into hotels and motels. Same thing happened in London and throughout England. New York City has 12,000 people in hotels and motels right now. Los Angeles County had at one point about 6,000 people in hotels and motels. So this has become a common strategy, and partly it's possible, excuse me, because FEMA pays 75% of the hotel costs, and local communities, including with their CARES Act money, pay the 25%. And this covers 90 days per person, by the way, which will come up as important. Another set of things is communities. 30% of the communities report that they had to close shelters because they couldn't accommodate social distancing. 38% open new shelters. Many sites are using this opportunity to fund new permanent supported housing projects. And as of the last survey, 40% of the people leaving hotels are going into permanent housing, which is really interesting because basically the hotels and motels have served as like a staging area where people can be stabilized and where case managers know where to find them 24/7, can reach them, deliver health services, deliver other social supports, and actually work with them to coordinate the move to permanent housing, which is actually an innovation that has emerged. But some people are still exiting to homelessness, and even a substantial number to this unknown. The other thing that has emerged is as these hotels and motels began to surface, is that many of them are struggling financially. They tend to be on the lower end of the tourist hotel market, and they are relatively low cost for acquisition. So some communities are actually buying up these hotels and motels and converting them to permanent housing. In some cases, dropping in efficiency apartments if they can, or and so I think that New York City is doing 3,000. California, the governor and the legislature allocated $800 million for communities to buy hotels and motels. Los Angeles, I know, is planning to buy about 5,000 rooms. So again, an interesting thing that emerged that was not really on the radar screen before, but sort of creates an ability to scale, to get a significant number of new units without lots of new construction and all the time that takes. But the communities also have reported significant challenges that we see. One is that there just was no coordinated testing approach with the shelter system in most communities. So people who were homeless are just getting tested with everybody else, and there's not always the report back that the person was living in a shelter. And that has contributed to some of the outbreaks. And some of the local health departments are so thin in terms of the number of people they have that they are not able to adequately mount a preventive response in the shelter system. Most of the sites reported they have shortages of PPE, big shortages in staff. I mean, probably the biggest thing everyone's talking about is that a lot of workers are not showing up for work out of the fear that they themselves might contract COVID by working in a shelter where there's not good ventilation, um, or because they have themselves been affected. But there's a lot of the shelters have had to train the homeless residents to take on all of the key jobs inside the facility because they've had a shortage of workers. Um, many places around the country are reporting unsheltered homelessness increasing as homeless people are choosing not to stay in the shelters because they fear contracting the virus, and they feel safer if they are outside and in a tent or living even in a small encampment. Um, and of course, a critical context here is that state and local governments who have to balance their budgets and can only spend money they have in the bank um, are facing significant revenue shortfalls because of the decline in business activity. And this is creating a very hard pressed situation. I'll just give you Los Angeles again as an example, because they have a new sales tax, a 0.25 cent sales tax that's dedicated for homeless services, and it's now in its 5th year. And it's supposed to produce about $500 million a year in services for people who are homeless, and most of it is to get people out of homelessness. Well, revenues are such that they're down to 135 million for that this year. So that's close to a $400 million shortfall in money that they would usually have to help get people out of homelessness. So these are real and significant direct revenue hits that are affecting the homeless population. So as I mentioned, FEMA has been paying for hotels 75%, and you could stay for 90 days. But that gives, the good news of that is it sort of gives everybody a target where they know the time at which this person needs to be transitioned into housing. And people can focus their efforts on that time frame as a way of planning for that transition. So I think in some respects, that's a good thing. The CARES Act, as I mentioned, has created $4 billion for prevention, rapid rehousing, and rental assistance. The good news on this program is that the money can be spent all the way until September 2022, which means that when this money became available around August, that basically communities could guarantee landlords that they could pay the rent for somebody for 2 years. And a lot of landlords, that sounds like a good deal to them. So a lot of units were opened up and commitments made, especially for the people coming out of the hotels and motels. The National Alliance is argued not to use the money for prevention because they think there are other categories of CARES money. Given the scale of the eviction problem right now, the the rent arrearage problem, this money would be spent in a minute if it had to cover the rent arrearages for people who are behind on their rent. So they warn that we should use the homeless dedicated money for people who are homeless and let the other CARES money focus on rent assistance and eviction prevention. As you may know, the CDC extended the national moratorium on evictions, but we still have significant numbers of evictions happening every day in this country despite that moratorium, because not every housing unit is covered, and many people don't actually even know what their rights are with regard to an eviction notice. The other big issue, of course, is utilities. That I think there's something like $34 billion in unpaid utilities out there right now, and those are all bills that will come due at some point, but makes it very difficult to think about doing this without federal assistance. So we're certainly expecting the federal government will have to come in.
Professor Culhane, one question.
Yeah.
When you talk about prevention there from eviction,
Yeah.
what would it be that the government would just be able to come in and pay for rent or something like that for a while?
Yeah, the current program, I think, pays $750 toward rent. Both the tenant and the landlord have to apply. The landlord can't be behind on taxes, and they can get $750 a month for several months of arrearages, and then the tenant is responsible for the balance on top of the 750. Now, there is likely to be some emergency rental assistance that's going to be in the bigger bill that the Biden administration is saying they're going to put on the table in January or February. And that is probably going to be pretty substantial. It could be $50 billion. But the thing is, we don't really have a mechanism for delivering rental assistance on that scale. And the housing authorities, who are the only public agencies who do large scale rent assistance, have said, we don't want anything to do with it. They're not our tenants. We'll take the money for our tenants, but we don't want to run this program. So it ends up that, places like Philadelphia, it has to be run out of the mayor's office, and they just don't have any kind of infrastructure to handle all these applications. So
do you have any ideas yourself about how that could be facilitated?
Well, I actually would make the housing authorities do it.
Yeah.
They have the staff. They could be given additional staff. They have the ability to write checks for rent money, and they know rent regulations. They're the entity. So I would say I wouldn't take no for an answer from them. But we will see what's going to happen.
Yeah.
Of course, we all know that simultaneous with this crisis has been the Black Lives Matter movement. And it has really put a spotlight on, systemic racism in general, but also the racial disproportionality in homelessness. People who are African American are 4 times as likely to be homeless as people who are not African American, compared to whites in particular. They're 12% of the US population, but closer to 44% of the homeless population. And we know that both COVID and the economic impacts of COVID are hitting Black and Latinx communities the hardest. And that partly that's because housing crowding, poor families crowd more into housing. And more people per housing unit is a driver of infection and contagion. A lot of folks are working in direct service employment and have to get to work on public transit, which makes them more likely to be exposed as well. And of course, they have high comorbidity rates due to historically bad access to healthcare and to poor health related to poverty. So you got to sort of all sorts of triple risk that's associated with being Black or Latinx, which is, increasing the crisis. And the street protests that have emerged, it was real interesting to hear folks talking about singling out homelessness, using this word unhoused, that unhoused people, which is, I think, an interesting rejection of the homeless label that has been adopted for so many years. And maybe it's less stigmatizing, as homelessness has come to mean so many more things than just being unhoused. So it's an interesting twist on some of these things. So I guess before I open it up for questions, I'll just say, a big thing we're, I think wondering is, will this be just a crisis that goes away and we proceed into the future, or do we think that there's going to be some kind of turning point in how we think about homelessness as a result of this? And I'll just give you a few things, some of which I've mentioned already. First of all, we are hearing for the first time national advocates talking about how congregate shelter is inappropriate as a way to house people, that it has all sorts of health risks that COVID made visible, but which are there even without COVID. And that, is congregate shelter a 19th century, Dickensian institution that should be on the trash heap of history? And if so, what will we replace it with? How will we deal with people who are having housing emergencies? Our hotels, with these 90-day stays and with a more coordinated transition to housing, is that pointing us in the direction of a new model that is better able to stabilize people, better able to engage them in services, and therefore has a better outcome in terms of housing placement. I think that right now the anecdotal evidence is yes to all of that. Because of the crisis, now more communities are aware of the aging of the homeless population, because in identifying the comorbid high-risk population, suddenly they observed, they had to actually look and document how the homeless population is aging. One of the interesting social welfare twists of this crisis has been that there's been increasing appreciation that people need some minimum income to survive, and that we don't have to have the stigma attitude of welfare that we've had for so many years, that we can expand unemployment, we can supplement unemployment, we can expand food assistance, and these things all go to improve the health and stability of the public. And we've actually had reductions in poverty in the United States as a result of the CARES Act, and the expansion of unemployment insurance and COVID unemployment insurance. So, that's pretty significant that in the midst of this big economic crisis, we have not seen an increase in poverty yet. This is just using the official statistics, of course. And the last couple of points, a lot of people have been talking about social determinants of health, homelessness being one of the key, popular conditions that constitutes a social determinant of health. And managed care companies have been saying that, but they really haven't been putting their money out there to help use their healthcare dollars to coordinate housing placements. That has been changing as a result of this, and some healthcare providers are using their resources to help pay for coordinated housing placement and case management for coordinated housing placement, and that could also signal a new vehicle of funding to help solve homelessness. And I guess the last point, which I've made already, which is, is this a turning point to something better, or are all of these deficits that we're experiencing, especially at the federal government, to pay for these emergency programs, and because of the tax, the hit on tax revenues, will it lead to a contraction in social welfare spending rather than an increase, because we're going to be facing such significant headwinds in terms of government spending? So that's sort of what I've got, and I'm glad to take questions.
Well, thanks so much, Dr. Culhane. One thing that I was going to ask, as you were, kind of indicating where you thought this might go in a positive direction as a turning point. At least, yeah, that model of hotels, as a transition towards, out of homelessness and whatnot. Are there, other things that you specifically would propose to kind of use this as a turning point, that we might be able to move towards something better?
Well, poverty is basically defined as having too limited of an income. And, people can say all sorts of things about poverty and why they think people are poor. But the bottom line is it's they just don't have enough money. And I think we've shown that the government knows how to get money to people and can increase their incomes, and people are going to use it to stabilize their lives, take care of themselves, and to do anything they can to transition to working and employment. And that we should not be afraid of learning that lesson, and that whether it's through a universal basic income, which I think is a long shot, or whether it's through fixing the main income support programs we have, they could reach further and they can reach longer, reach more people, and have a bigger impact if we were to improve those programs.
And with respect to that model of the hotels, like, can you give us any indication of how long of a long shot that would look like? Or
Well, I think that it's already going to be happening. So some of these hotel purchases are being converted to permanent housing, but some of them are going to remain temporary housing.
Mhm.
And because they're not suitable as permanent housing. Permanent housing has to have private kitchen and bath facilities. So a lot of these hotels, motels, you can put in an efficiency kind of, a galley kitchen and make it work, but not all of them. And so for a time being, many of these hotels and motels that have been acquired will be the new shelter system. And I think that's very encouraging. And it could show us that this is a much better way to go about providing emergency housing, increasing the quality, increasing the privacy, the dignity for the person, and also making it much easier for them to stay stable. They're not bouncing around outside. Most shelters are closed between 7 a.m. and 7 p.m. So people have to live on the street until the shelter's open. And living outside all day,
Mhm.
leads to all sorts of things: victimization, harassment by police or other security personnel. Bad things happen when you're spending your whole day outside. So I think that a 24-hour model with privacy, stability, access to case managers who know where to find you. I think that really should be where we're going. And I would be surprised. I'm willing to bet that they may not cost more than the shelters, because the shelters.
That's what I was going to ask. I remember you had told us how, from a healthcare standpoint, getting people off the street, you were able to prove was actually less costly to governments. Is maybe that would, you'd have to do some research to actually see what the costs involved would be.
Exactly. There could be secondary effects of this that also justify it from a financial perspective. But congregate shelters are expensive.
Mhm.
A bed still runs on average around $25,000 across the country. In most places, it's $15,000, but it can run as high as $25,000. And so I think that that's a factor, and it would be good to do a little more research to figure that out.
Do you have a ballpark of what it might cost for one of these, like a hotel room or something like that?
I actually don't know what they're selling for these units. That's a good question, but I have not tracked that. But I know that LA got close to 100 million for 4,000 units. So you could do the math yourself. But I don't know what the answer to that is.
I have a question.
Yes.
Hi, my name's Teresa. I'm a recent grad at Penn, but I'm coming back to listen to this talk. Thank you so much for coming in. My question is, you mentioned that workers weren't coming into homeless shelters, and I was curious about people kind of taking up the slack, people who are experiencing homelessness, who want to live in the shelters, of completing chores that need to be done within a shelter. And we talked a lot about the dignity of the human person and where they should stay. But my question is, has there any been follow-up of what has happened in those shelters when people have to kind of rise to the occasion and do work, and like the dignity of work, and how that has affected people later on down the road in either holding a job or finding a place to stay?
The short answer is no. I would say that, we do know that most shelters have historically relied upon the volunteer labor of clients in order to survive. So they have paid staff, but they also have lots of unpaid staff, volunteers, who might, in exchange for volunteering, get access to some privileges in the facility. And so this has been, some people have been concerned about the exploitive way that the labor of homeless people has been used for these facilities. But what's happening in this case seems that people are having to occupy paid positions or what were paid positions. And are they getting paid or not? I don't know the answer to that. So that would be something that would be very curious to know more about. But the shelter hierarchy has for years had some sort of ladders into work for clients who are aspiring to work at the facility. So that would not be a new phenomenon, but we just don't know the scale of what it is that's going on right now.
Gotcha. Thank you.
Regarding the growing number of homeless elderly, is that something that we even, like, on a theoretical level, have a good understanding of how to deal with? Like, is there a fair number of shelters that focus on the elderly, and like we understand how that would scale, or is this something that it's not just we don't have the infrastructure, we don't even know how we would handle it?
No, so I on my website, there's a website, Selected Works, of Dennis Culhane. You can go there, and on there you'll see a very recent publication that I have put up. I was hired by the County of Los Angeles to come up with a plan for how they would house all of the elderly homeless. It says it's a pilot, but that's because the state funding was going to come from some pilot funding, but the idea is it would actually be comprehensive and house all elderly homeless people in Los Angeles. And you can see in that report, we have analyzed the subgroups, the different housing models that would be appropriate for the different subgroups, what those would cost, who would pay for what, from what revenue sources, what would be the anticipated cost offset associated with reduced use of nursing homes, hospitals, and shelters, and how that could motivate the people who would save money to put more money up front. So all of that is in that report. And so we have thought it through. There is a question out there. What's going to be the Biden administration's housing priorities? The campaign stated that one of its priorities was going to be to close the gap between the eligible households for housing assistance and the number who get housing vouchers, which would mean basically tripling the number of people who got housing vouchers. That's a big ask. That's a $30 billion a year expenditure. A lot of people don't think it's realistic, and that the administration is actually going to put that forward as a priority. So the question is, will they make homelessness a priority, which we don't know, and if they do, or will they might perhaps make elderly homelessness a priority, which is a possibility, in which case they might propose a collaboration between HHS and HUD to do the services and the housing to get elderly people housed. So that's open question. It is being discussed. People on the transition team are floating these ideas. Until we get a HUD secretary, I don't think that discussion will go very far, but it's all still out there to be decided.
Something I was wondering, are you predicting increased numbers of people who are living on the street and encampments because they feel safer living there versus other shelters? And do you think that's going to be like a permanent increase or a permanent shift?
Well, it has been, the growth in homelessness has been in unsheltered people because there's no shelter beds for them. So even if they wanted to go to a shelter bed, most of the people who are unsheltered, there's no bed for them to go to. We have as many people living outside as we have in shelters, and shelters running around 90% occupancy. So there's no way that we're going to do that. So I don't think that the fact that people have been living on the street to avoid COVID will be a permanent shift. I think people will go back to shelters, but who knows? I mean, every community is reporting increases in encampments. People are choosing to live outside where they have more control over their lives than if they're in these facilities. And, communities maybe are becoming more tolerant. But, that could happen. The main thing, of course, is the question, will we see an increase in homelessness as a result of the COVID and economic crisis, or we could actually see a reduction in homelessness because we have this $4 billion that's been put out there that has to be spent over the next year and a half. That's double the HUD budget for homelessness. So that's a substantial amount of money to be spent over the next year and a half. So we could have the paradoxical thing like with poverty. We might actually see a reduction in homelessness, but it's too early to tell.
Professor Culhane, one thing that you brought up was about the disproportionality within the sort of racial population compared to those in homelessness. And with what's been going on over the summer of BLM, do you have, I don't know, a direction that you think that could go? Is that, that racial, or like even when we hear about kind of the reasons why, the African American population has been underprivileged, and the housing sort of back to the 50s and 60s and that type of thing. Is there, other than is it just putting more money into specific areas, like a way to try to get out of that, or do you have any ideas with respect to that?
Well, I think that if we're going to take the systemic racism challenge honestly and really do a careful self-examination, we have a lot to admit to. We have a lot to acknowledge with respect to how Black and brown populations have been impacted by housing finance and the way that's been structured, housing policy, how that's impacted education financing and underfunding of schools, especially for Black students, how that's impacted their opportunity as adults. These are cascading problems that have been accumulating over decades. And if we're really going to first acknowledge, but secondly, do something about it, we're going to have to, really have to understand and appreciate how deep these divisions go. And we can't keep lying to ourselves and say this is somebody else's problem and that we're not actually, we do this every day. We reproduce those inequalities every single day by the virtue of how our housing market is structured, how our schools are financed, and the history of segregation that we've inherited. And so if we're really going to do something about this, if the new generation of young people really wants to take this on and really bring about a greater social justice, it's gonna be a major reckoning. But I think it's called for, certainly. It's just, it's very difficult. These are big, tough problems that are deeply historical, but yet continue every day with the momentum of the tides. It just keeps coming and coming and coming every day. And that's the way we live. So I think we have a lot to answer for and a lot to think about.
And maybe just, following up on that, I think amongst our groups, one of the things that you really see, especially amongst the youth, is we want to do something about it, but what can we do? And sometimes feeling so powerless to make a change, and obviously it starts with each one of us, to look at our own lives. But from the social policies to take seriously or to look for, I'm sure it really goes across the board where you're talking education, housing, and the like. Is that, can you say a bit about that?
Yeah, I think that education and housing are the two biggest factors, and they are connected because, our education system is funded largely from local property taxes, and the housing markets are segmented jurisdictionally
Mhm.
to create, islands of privilege,
Right.
and also to separate them from, concentrated areas of disadvantage. And so those things reproduce themselves. We have to think about delinking property taxes and education funding, and having a more standardized, universal, generous education benefit for everyone, a school construction and rehabilitation program. So, taking that on straight away. Also, creating more housing opportunity, including multifamily housing in communities that have typically rejected those, so that there's more access to those communities by more diverse people, and providing special loan, mortgage programs that help low-income people and first-time home buyers achieve home ownership, and or even to get more rental housing quality in different areas that have been historically redlined. So I think there's a whole way to do it. I don't think that it will be race specific, because race specific programs are pretty hard to sell and may not be legal in many cases. But if you target low income people, and if you target people who are in disadvantaged areas, you will by necessity be capturing disproportionately people who are Black, for example. And so they would be the big beneficiaries. But I would say education and housing are the two areas where we could have the biggest impact, direct impact.
And does delinking the property tax from education, does that, a state by state thing? Is there a way, I mean, does the federal government have a way of stepping in, or how could that happen?
The federal government, I think, is like 6% of the education budget. So they could do a lot more by just upping that to 8, 9%, but no, I think the states decide the funding formula for schools. And there are close to 30 states that have actually faced litigation saying that the funding for schools is so unequal as to constitute a violation of people's constitutional right to equal access to education. And so cases like that have succeeded all around the country in forcing states to do more central revenue funding to offset that balance. New Jersey went through this. States like Connecticut and Texas actually had to pass income tax laws that they didn't have income taxes at the state level in order to comply with those court orders. There has not been a successful challenge of the funding formula in Pennsylvania, because the way our Constitution is written has not been amenable to that kind of suit. But there have been several dozen states that have had successful lawsuits on this basis. But the legislature could do this as well on its own. But of course, the legislature being governed by these same jurisdictional biases, it will make it hard to do so. So yeah, we've got it's an uphill climb. Thank you for having me.
Yeah, Doctor, this has been great. Thank you so much for coming back to visit us.
Yep, glad we had a conversation, and hopefully we can meet again next year, and it will be in person.
Yeah,
Definitely.
we
Yes.
look forward to that.
Me too.
Yeah, well, thank you so much for taking the time. I know you've been really busy, so thank you for taking the time to come talk to us
So
today.
welcome. I'm glad I was able to do it, Courtney. And thanks, Patrick. Thanks to all of you for being here and having the patience to sit through yet another Zoom class.
This is great. Yeah, we appreciate it.
We're all zombies, zoomy zombies. But good luck with all your exams, everybody, and your final papers and projects. And I hope you have a great holiday. And hopefully the spring will bring us closer together, but not entirely, but hopefully we'll have some improvement.
You as well.
All right.
Take care.
Thank you. Bye.
Bye-bye.
Bye.
Thanks.